Hello once again. My name is Tosin Adewale, and today we are going to continue on medication administration. So, yesterday we talked about the six rights of medication administration. So, today we are just briefly going to discuss the things that you need to do if your client should refuse to take their medication. So, the first thing you need to do is just to stay calm, because if you are in a hurry because you want to meet other targets or you want to go to another client's home, you will make mistakes. So, if your client should refuse, the first thing you need to do is calmly and politely ask why they refuse to take the medication. So when they give you a reason, that is what you are going to put down in your note, in your care note. Remember, you must always write all refusals. One thing you need to know is that nobody is expecting you to do any miracle. Nobody is expecting you to force the medication on the client. You are not supposed to force the client to take any of their medications. So if they tell you the reason why they refuse to take it, just put this in your notes. Then if you have already dispensed the medication, that's it's already, you have already taken it out of the pack or from the blister pack, you you will have to follow your company's policies on how to dispose, medications. Some organizations will advise that you should contact the pharmacy. Then the pharmacy will tell you, advise you on where to put the medication away from the client, and then they will come and pick it up. There are different ways, or they might tell you to put the medication in a container, and they will tell you to bring it to the pharmacy. Whatever policy you have, you must list out the medications that you have already dispensed. You must list them out, and writing the size. That if it's aspirin, you write aspirin 75 mg, that it was supposed to be taken in the morning, like that. So you list out all the medications, and then you put the list together with the medication. Probably you put it in a container or something. Then the pharmacy will come pick it up, or they'll tell you to bring it to them. So the second step you are going to take if your client should refuse to take their medication is to um, put write this down in your notes. I think I mentioned that earlier. So you just write it down in your notes and make sure you write the name of the medication, the time it was supposed to be taken, the size, the strength. Write everything down about the medication that was refused, and you must record this appropriately in your records. Maybe you use the care app, or maybe you have to write it down in a book. You must make sure you write everything down correctly. Carers are not um, allowed to secretly, administer medication to their clients. It's called covert administration, where you will have to uh, probably hide the the medication in their food, or put it in a drink or something like that. Carers are not supposed to do that. But if that's what the client wants to do themselves, let them do it themselves. And you are going to write it down, that in your notes, that that's what the client prefer to do. Okay. So another thing you need to consider is that if this is like now a trend, like your client keeps refusing to take their medication, you've gone there in the morning, they refused, afternoon they refused, at night they refused, then you have to report. You have to report to you have to call 111 if you are in the UK, to report this to the nurse. So the nurse will now advise on what to do. And also you need to report from the first time that the client refused their medications, you have to let your supervisor know about it. Okay, so if it's now becoming a trend, the first time, the second time, the third time, that's when you have to contact 111 yourself, and then you explain to them what is happening, and they will give you advice on what to do. if if this should continue, then there are situations where we'll have to involve their social worker, their GP, or they will have to do probably like a mental assessment of the clients, just to know why they don't want to take their medication and all that. So whatever the case is, you must make sure you report this immediately. If it is their first time um, refusing to take their medication, you should immediately inform your supervisor about it. I have a course on medication administration, which you can get on link Linktree/care for carer. So if you go on there, you see the course. It's a full course on medication administration, so you can always click on it. It's just for a very little price, and it's in PDF form, so it will be very easy for you to read about it. If you want to send me a message, you can always comment, like, and share this, so that everybody out there will get to know about this. Thank you.